Hello, everyone. Okay, so to celebrate our 30th anniversary at In Touch Primary Care, we're going to be having an open house and ribbon cutting. So if you're in the Houston area, please come join us, and you can register by going to the link in the caption. All right, this month we've been talking about prediabetes and diabetes, and we've learned what it is, why, how to prevent it, how to reverse it, primarily with lifestyle changes. Last week, I focused on diabetes, and I shared my top 3 tips for people with diabetes. So if you haven't seen that, you can go back and look at that. And today I want to discuss medications and answer some questions like what medications can cause diabetes, when should diabetes medications be prescribed, or when are diabetes medications prescribed? Are diabetes medications safe? You're listening to Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugar Land. We're an innovative medical clinic, and we offer an alternative way to receive healthcare that is stress-free and focused on the patient. Okay, so we've talked a lot about lifestyle changes and what you can do to lower your risk of diabetes and prediabetes, or even reverse it. But there are times when this becomes a little bit more difficult. And oftentimes that happens when someone is taking another medication that increases their risk of diabetes or prediabetes. And it's important to be aware of those risks. And that's why, seeing a doctor, and not just anybody, can make a difference. So what medications can cause prediabetes or diabetes? And there are a few of them. So the risk of that increase, there are medications that actually increase your risk of prediabetes and diabetes. So for example, thiazide diuretics, which are, a lot of people know them as water pills. Many people take them for high blood pressure. Some others take them for lower extremity or swelling of their legs. And some examples of thiazides are hydrochlorothiazide or clothalidone. And these medications can increase blood sugar levels, and therefore over time increase the risk of diabetes or prediabetes. Another class of medication that can do this are beta blockers. So some examples of that are metoprolol, propranolol, carvedilol. Those are very common examples of beta blockers. And they're also used in treatment for high blood pressure, or sometimes in case of heart disease. And they also affect your insulin. So what they do is they reduce the sensitivity to insulin so that your body does not use the insulin as well. The insulin you have does not work as well. And so the glucose stays in the blood instead of being cleared from the bloodstream. So obviously that would increase the risk of diabetes or prediabetes. Another class of medications are corticosteroids. So for example, prednisone, dexamethasone, these are steroids that can increase blood sugar levels, especially when taken for a long period of time. So sometimes people do need to take steroids for a prolonged period for several conditions. And many times, they should be aware that it can increase their risk for prediabetes or diabetes. Another common medication that can increase risk are statins. So those are medications used to lower cholesterol. Common examples are atorvastatin, also known as the brand name Lipitor, rosuvastatin, brand name Crestor, and there are many different statins. And they have been linked with an increased risk of diabetes. And then there is antipsychotics, which may be used in treatment of dementia, or in some cases in schizophrenia, and those can also increase the blood sugar levels. So the point is, there are many common medications that can increase the risk of prediabetes and diabetes, and it's important to know if you're making lifestyle changes for 3 reasons. Number 1, you can keep an eye on it. So that is by following up with your labs, following up with your doctor. Remember, this may not happen to everybody, but it's important that you understand if you're taking medications like this, that there is a possibility that that will happen. And so you want to be consistently following up with your doctor and keeping up with your lab work. The other reason you may want to know this is so you can consider alternatives. Sometimes maybe you went somewhere, you had high blood pressure, somebody just randomly started you with something and you just continued it. You didn't follow up with your doctor, you've just been getting refills. That is not the way to do it because that's how things like that backfire. Maybe you can go on an alternative medication that will work just as well without that side effect, especially like if you had a family history or you're already pre-diabetic. So you want to know that this may happen so that if there are alternatives that can work better for you, you can start on those alternatives. And then the last thing is, if you're working hard on lifestyle changes and you understand that there are side effects from other medicines that you're taking, it's easy to make, adjustments so that the lifestyle changes that you're working on will help so that you can actually reduce your dependence on medications. So it's important to understand what can cause, what medications can do, how they can affect your body in certain ways so that you can be safe in taking them. Okay, so does that mean we shouldn't take medications at all? No. Okay, that's not what I'm saying. Medications can be life-saving, and a major role doctors play is to partner with you to figure out what medications will work for you and to balance the risk and benefits. So everyone is different, and many people can stay on medications. Even a lot of the medicines I listed above, many people can stay on them for years without developing any problems. But it's important to know that they can cause potential side effects so that if you are keeping track of it, so that you can keep track of it and avoid those complications or side effects. So you need to discuss with your doctor, find out what's best for you. If you are in the Houston area and you're looking for a doctor to help, don't hesitate to contact us at In Touch Primary Care in Sugar Land. You can go to our website, intouchprimarycare.com, to get started. Okay, so for diabetes, when do you consider medications versus lifestyle changes? So when is diabetes medicine prescribed? So in prior episodes, I discussed how lifestyle changes can help lower blood sugar levels, but it comes a time in some people when it may be better to actually start medication while waiting for lifestyle changes to take effect. So when is diabetes medication prescribed? Well, the first time will be when lifestyle changes are taking time. Lifestyle changes take time to work. They take time to do. It's a process to build healthy habits, and the body needs time, even once you start, to heal itself. But the problem is, while waiting, we talked a lot about how diabetes works in the past. While waiting, the high blood sugar levels in the body can actually cause permanent damage to organs. So if your blood sugar is high or has been high for a long time, or has been high for an unknown period of time, say you just haven't seen a doctor for 5 years, you go to the doctor, they now say you have diabetes. We don't know when that started. It may be better for you to start medication at that moment so that it can work quickly to reduce your blood sugar level so that you don't expose your organs to high blood sugar levels and to damage over time. So it's important to, weigh risk benefit, as I was talking about earlier. The other thing is your body responds better to lifestyle changes when your blood sugars are low. So it's hard to fight physiology, right? If your body, if the cells in your body are not healthy, if your body is under stress because of high blood sugar levels and because of the inflammation that is caused by that, whatever lifestyle changes you may be making will not be as effective. So using medication to lower your blood sugar can be very helpful initially, and then over time, if lifestyle changes kick in eventually, you're consistent with them. If things, once you start to get your blood sugar lower, then you can have that conversation with your doctor about lowering your medication or maybe even stopping them. So This is very important, and I want to stress it because I've heard a lot of people say, I don't want to take medication because of side effects. And some people go into so much extreme, they go into the extreme and they harm themselves by not taking medication when needed because they're trying to avoid medications, because they're trying to avoid side effects. But the thing about side effects is side effects don't happen to everyone. Many medications are not approved if there's a high percentage of people with significant side effects. So majority of people would not have side effects. So that's one. The other thing is side effects can be managed. And that's why some medicines are prescribed rather than available over the counter, and others are over the counter. The prescription medications are so that you are taking it with the help of a doctor so that you can safely take it, so that if you do have a side effect, it can be stopped or it could be quickly resolved. So that's the other thing about, I know people do get into the habit of just, calling in, asking someone to call in refills. That is a very dangerous way of taking prescription medication because that is how you miss subtle side effects like increasing blood sugar over time, like diabetes or high cholesterol, that can be very cause significant problems over time. But if nobody's checking your labs, you're not following up with anybody, those things can be very easily missed. So I think taking medications can be life-saving. They can be very important, but it's important not to be extreme about avoiding them and then putting yourself in danger because, just over permanently affecting your organs just because you're trying to avoid taking medications because of the possibility of side effects that may not even be true for you. Okay, I hope that makes sense. So let's talk specifically about medications for diabetes. Diabetes medication safe. So first we can, I'll just briefly talk about the different classes. They are medications for diabetes, all of them, there are many different classes. They work differently. Some of them, they work by blocking the breakdown of carbs. Others decrease the amount of glucose your liver produces and releases, and they make your muscles more sensitive to insulin. Others prevent the natural breakdown of natural compounds like GLP-1. GLP-1 is a compound that lowers your blood sugar, but by stopping the breakdown of it, you can keep it in the blood longer so that it can help to lower your blood sugar for a longer period. Others do it by getting rid of the excess glucose by helping you urinate out the extra glucose. Others by increasing the amount of insulin produced by the pancreas. So the bottom line is there's so many ways that medicines work to lower blood sugar, and there are many different ones, but overall they're safe. Overall they're safe. All medications have potential side effects, but when they're taken as prescribed with supervision from a doctor, many medications can be taken safely for years. So I work with patients to lower their dependence on medications with lifestyle changes. But like I said earlier, it's very important to weigh the risk and benefits because at times you may have to add medications initially to protect your organs, to prevent complications, so that you can lower or avoid medications in the future. I hope that helps. So as always, check with your own doctor. If you're in the Houston area and you're looking for a doctor to help you with your prediabetes or diabetes, don't hesitate to contact us here at In Touch Primary Care. And like I said, you can go on our website to get more information. So see you next week at 2 p.m.